To continue this call in English, please press 1.
Para continuar con esta llamada en español.
This call may be monitored or recorded for quality assurance. For card members, when checking your balance, please note your card may have multiple wallets. Please listen for each wallet carefully.
Thank you for calling the OTC network. Please visit the website printed on the back of your OTC card to check your card balance, discover eligible products for purchase, and find retailers that accept your card. To report a lost or stolen card, please contact your health plan's member services. To get started, please enter your 16-digit card number followed by the pound key. The number you entered was invalid. Please try again. To get started, please enter your 16-digit card number followed by the pound key. The number you entered was invalid. Please try again. To get started, please enter your 16-digit card number followed by the pound key. Please enter the 3-digit security code located on the back of your card, followed by pound. The number you entered was invalid. Please try again. Please enter the 3-digit security code located on the back of your card, followed by pound.
That's better.
The number you entered was invalid. Please try again. Please enter the 3-digit security code located on the back of your card, followed by pound.
Please enter your date of birth in the form of a 2-digit month, 2-digit day of...
The current balance on your card is
$0.00.
If you would like more information, please select from one of the following options. To repeat your balance, press 1. To hear your last 5 transactions, press 2. To contact your health plan member services, press 3. If you would like more information, please select from one of the following options. To repeat your balance, press 1. To hear your last 5 transactions, press 2. To contact your health plan member services, press 3.
Please hold while we transfer you to member services.
Welcome to Aetna Better Health of Louisiana. If this is a life-threatening emergency, please hang up and dial 911. All calls are monitored and recorded for quality assurance purposes. If you're a healthcare provider, press star. If you know your party's extension, press 0. Otherwise, please stay on the line for further information.
Para español.
What can I help you with? Say eligibility and benefits, ID card or welcome packet, case management, nurse line, transportation services, mental health crisis support, or more options.
Eligibility and benefits.
Now you can say medical, vision, dental, mental health, or something else.
Something else.
What's the member's ID? If you need a minute to find it, press star and I'll wait.
579-403-864-5696.
579-403-864-5696.
Is that right?
Right.
I missed that.
5794.
What's the member's date of birth?
May 22nd, 1997.
May 22nd, 1997.
Is that right?
Yes.
What's the member's first and last name?
Jeffrey Bodin.
We found the information you're requesting, but aren't recognizing the phone number you're calling from. After this call, please contact the state to update your records. Transferring you now.
If you need a ride or speak to transportation, press 1. If you would like to speak to a member services representative regarding all other questions, please press 2 or remain in the line. We value your feedback at Aetna, and if you have a moment, please hold after your call to take a brief survey. More than 13,000 women in the United States are diagnosed with invasive cervical cancer each year, but the disease is preventable with vaccination and appropriate screening. HPV vaccines can help prevent infection from both high-risk HPV types that can lead to cervical cancer and low-risk types that cause other problems. HPV vaccines can be given as early as age 9. Completing your routine pap smear can detect HPV early on. Talk to member services about making an appointment with your doctor to have your cervical cancer screening or HPV vaccination. From late June to late August, we will be reaching out to our members to ask about their experience with our behavioral health services. This survey will be sent in the mail via paper form. If members receive this survey, they should complete it and send it back right away. Thank you. All calls are monitored and recorded for quality assurance purposes. If this is a medical emergency, please hang up and dial 911 or contact your local emergency services. It's flu season. Getting a new flu shot each year helps protect you and your family from this serious illness. This year, with the ongoing pandemic, it's more important than ever to get the flu shot. There is no cost for the flu shot, and getting a flu shot won't give you the flu. Contact your doctor today or ask your member services representative for details. Please hold for the next available representative.
Thank you for calling in the Mandeville of Louisiana. My name is Nisha. How may I help you today?
Hi, I called Meditrans earlier, and informed me something about my insurance coverage with them, like regarding them either not being up to date for Meditrans or it like canceling on the 28th or something. And that's the first I've heard of that, which would be weird because I already went through the whole Medicaid process for renewing my Medicaid last year, and that was successfully completed. So since I haven't received anything in the mail or any notice from the state or the feds, I think it's probably something to do with them internally, and they told me something about I needed to get their system updated. So if there's something y'all can do on your end to update Meditrans's system somehow, in case it for some reason has out-of-date data as though I still don't have or still was about to lose insurance coverage somehow, which would obviously not be correct. That's what I'm trying to accomplish.
Okay, and if I'm speaking with Mr. Jeffrey Bodin?
Yes, ma'am, that's correct.
Okay, can you verify your date of birth for me?
05/22/97.
Okay, so it does show in our system that your policy is terming on the 28th of February 2026.
How?
So, I'm not sure. I will have to get you over to Louisiana Department of Health. So you would need to speak with them to make sure that your information is accurate with them.
Does it show you when
that
changed in y'all?
I'm sorry, repeat that for me.
Does it, like, the date that changed as reflected as terminated on the 28th? Because I have documents, I printouts from y'all's system that shows I do not have a date that terminates until 2078, I think, somewhere around there. So for it to just terminate, there should be a date that was entered in y'all's system or shows like right next to it, from what I know I can see. Or could have seen. So like, does it show y'all when that changed? So I can at least know that to tell.
No, sir. No, sir. That would be something that Louisiana Department of Health will have would be able for you. But give me just because I'm checking the Medicaid website to see if it is something in our system or if your Medicaid is still active. So just give me just a few moments, okay?
Okay.
JEFFRDY. 522.97, correct?
Yes, ma'am.
Okay, let me. So as of March 1st, it does show that you would that you won't have an active plan.
How? The state sent me mail like in November last year. And then I had issues in December, but then I got it right back. I spoke with the Medicaid analyst for the state. Sent my bank records, did all of that. And they stated that they extended it for 12 months. It's
okay. So I will have to get you over to speak with them.
March. That's a bit odd.
Yes, sir, and I do apologize for the interruptions and the overtalk. I'm sorry, the crosstalk.
That's
so
fine,
I will have to get you over.
Fine, I understand.
You're totally fine, sweetheart. But I will need to get you over to speak with them to see exactly why it's terming. Has your income or anything changed?
Nope. I reported everything to the Medicaid analyst.
It's the same.
Okay. So give me just a moment. I'm going to get you over to that department, okay? Thank you so much for holding, Mr. Jeffrey.
Yes, ma'am.
Yes, ma'am.
Okay, so right now it's stating that they're experiencing a high call volume. They do close at 4:30. I can provide you with that number so you can reach out to them.
Yeah, okay.
To get that information, okay?
One sec.
One sec.
Okay, who's this number directly to?
Okay, who's this number directly to?
This is the Louisiana Department of Health, so it will be Medicaid.
Okay, what's the number?
Okay, what's the number?
888-342-6207.
888-342-6207.
Yes, sir.
Okay.
Okay.
Okay. Is there anything else I can help you with, or any other questions you may have today?
Nope.
Nope.
Okay, well, again, I do apologize about that. I'm not sure where the mix-up came in at. But I do thank you for calling in the Better Health of Louisiana. At the end of the call, there will be a brief survey on the services provided to you today. If you do have a brief moment to complete that survey, I would greatly appreciate it. Again, I do thank you for calling in the Better Health of Louisiana. One moment while I get you over to that survey.
Transferring to survey domain.
Your feedback helps us improve. Please answer all 5 questions using the numbers on your telephone keypad. You'll have an opportunity at the end of the survey to leave us a voice comment. Let's get started. Thinking about the representative you just spoke with, please rate your experience. Choose any number between 1 and 5. 1 means you strongly disagree, and 5 means you strongly agree. Remember, the higher the number, the higher the rating. I was satisfied with the service I received today. The representative was easy to work with. Now, thinking about this call using a scale of 1 to 5, with 5 being very likely, how likely are you to recommend us to others? 4, likely. Is this your first call regarding this inquiry? Please press 1 for yes and 2 for no. Was your representative able to resolve your request? Please press 1 for yes and 2 for no. We apologize that we were unable to resolve your issue today. Please tell us what we could have done better. We would love the opportunity to get it right. To leave us a voice comment, press 1 on your telephone keypad and wait for the tone. When you are finished, simply hang up. We appreciate your feedback. Thank you for calling, and have a great day. Hi there, we're calling for Jeffrey Bodin. If you're not Jeffrey Bodin, we're sorry. Please hang up. Hi, Jeffrey Bodin. We are calling on behalf of Filename with University Medical Center Cancer Center. You have an appointment at 12:40 p.m. on February 2nd, 2026. This appointment is located at 2000 Canal Street, Hospital Tower 1. First floor, New Orleans, Louisiana. Bring insurance card, picture ID, and co-payment or deductible to appointment. If you need to cancel or reschedule your appointment,
please call 504-702-3311. Congratulations. You're taking a step towards living healthier. We can't wait to see you. Thank you for choosing us to provide one-of-a-kind care for a one-of-a-kind you.
You know, I hope this is the last mistake the state makes. This type of thing. Last year was reasonable, even though it was too stressful, and I lost weight because of that. It was too much. But I was able to get it, well, you know, I had an extension for a month somehow, which was when it was all resolved, and it was fine. Well, I mean, not fine. I did have, what was it? A few neurology tests, a brain MRI, and a CAT scan, I think, were both canceled because of the whole thing. And they decided to do an EEG with the leads and stuff, which they did in January. They decided to do that instead. I'm supposed to have another one next week for 3 days. The insurance already cleared it and everything too. Wasn't a problem. So, you know, I hope that we don't see this continuing to be an issue at complete random time period with no notice to me sent. There was a lot of notice sent in, maybe starting in October of last year, and the last very end of October, very beginning of November. I didn't get anything at the beginning of February. Didn't get anything at the end of January. There was nothing sent, received, nothing delivered. And I had appointments. Had appointments last week. Had appointments to video. Went to appointment today, got 2 potentially cancerous for melanocytes moles removed today, the 18th of February 2026 at Dimitri Dermatology, and I was supposed to have an appointment with them scheduled to follow up for the results and to check the sites in case they needed to excise more tissue, and that was supposed to be in 2 weeks. And they're sending the tumors away to get them tested too. And, you know, melanoma is about 4 weeks, and then it had a second stage 5 cancer. I'm sure the state doesn't want to be culpable for another intron A infusion schedule. I wonder, you know, how many millions it was last time. I'm sure that can be jacked up in price this time to ensure that there's not going to be a third. Seeing as how my oncologist is the head of VA's infusion and the professor for it. It's not a very good thing to continue this canceling my insurance. Not canceling my insurance, canceling my insurance. I have a Medicare card too now. It just doesn't activate until May 1st. Pretty sure this is probably intentional by someone. As it's not like Aetna would benefit from this. So I really doubt it's their fault. They just got reviewed by the state and given a year grace period to continue to have a contract for Medicaid. They have no incentivization, and that was as of December 31st, 2025. So why would they be incentivized to, screw up?